to the Thought Snob Podcast. I'm Paula Swope. Let's get snobby. If you have questions about healthcare insurance options, you must watch this episode. This week on the Thought Snob Podcast, I had the privilege of sitting down with two incredible guests from WOOP Care. Dr. Michael Miller, who is the Vice President of Partnerships, joined me along with my buddy Jordan Doepke for a conversation that completely shifted the way I look at healthcare in America. We spent an hour and a half unpacking how WOOP Care is different from traditional health insurance companies like Anthem and Humana, and let me tell you, this was eye-opening. Unlike the big insurance giants, WOOP Care is patient-centered. It empowers real people like you and me, to make decisions about our health care without being bullied, manipulated, or boxed in by an insurance provider's red tape. And I'll be honest, I walked into this conversation with very minimal knowledge about how health insurance companies truly operate, but I walked out wiser and at the same time, deeply disappointed. What I learned is that even medical doctors are often at the mercy of health insurance companies. They're stuck in the system just like we are, and that was a sobering realization for me. Now, you might be thinking, how does an episode about occupational health services and insurance companies fit with the Thought Snob podcast? But here's the thing. It's actually a perfect fit because what WOOP Care is doing aligns directly with our mission here, empowering individuals to reclaim their freedom, their choices, and their well-being. WOOP Care is about putting the power back into the hands of the individual. It's about reshaping the healthcare experience so that you can navigate health issues with clarity, confidence, and dignity. And if you've ever felt like the healthcare system was designed to work against you, you'll want to hear this conversation. So tune in, open your mind, and prepare to see the healthcare system and your own power within it in a whole new light. So won't you tell me how you two know each other and how you two got into this collaboration together?
So I was looking to transition back into healthcare. So I was in health insurance forever. I got licensed in 2004.
Okay.
And I got licensed in both sides. So in insurance, there's kind of two sides. You have the employee benefits side, and then you have the property and casualty side.
Mm-hmm.
And so I always was kind of on the employee benefits side. And I started those restaurants, Green District,
Right.
and we did that for healthy eating. We just felt like there wasn't a lot of alternatives to eat healthy. So when we created that, I was CEO for 3 years, and then it went really well, and we expanded a lot. And then after the 3 years, the guys that invested us wanted to kind of slow down a bit, which I get. And so for me, restaurants are hard.
I'm sure they are.
Insurance was a little easier because I can work with really smart people like this, and you don't have thousands of employees, right? If we get sideways, we can talk about it. When you got a lot of employees, there's just a lot to manage.
Mm-hmm.
So I kind of took a hiatus for like a year, and I consulted. We talked about that, I think, in the past. Thrive 365, they're a diabetes app. I call them almost a digital therapeutic, but not like officially. But basically what it is an algorithm that helps you identify your foods. So they've scanned 800,000 different restaurants, like 1.2 million foods that are at your Publix or Kroger or wherever, and you could just scan the barcode. But what it does is it tells you as a diabetic what you can and cannot eat.
Yeah.
Which is very different than just being healthy, right? So anyway, I could go down that tangent forever, but as I was doing that, I ended up connecting with this guy, Dave Berkmeyer, at On-Site Health Solutions.
Mm-hmm.
And as we started connecting, I was working with some other distributors, and they're like, you need to meet this Dr. Mike guy in Columbus, Ohio. And so we had lunch, and I'll pass the baton at that point, and I'll let you take the rest of the story. But we had lunch.
Yeah.
The rest is history, I guess.
Yeah, we did have lunch. So I'll just go a little bit back. I won't go through like the previous 30 years of my life. That would be too boring and too complicated, probably. So I actually started down this path through the clinical side, medical school, residency, family medicine, that whole path. So my exposure to insurance was really from that point of view, seeing things from the patient side, not having any visibility to the, business side of it. But as I kind of went through that process, the education, you sort of start realizing how kind of those cards are stacked against the patients, in many cases employees of these, that have these health plans. Also the doctors' hands are tied all the time, kind of have to take orders from who's paying for, you know, that particular treatment or that visit. So a lot of kind of what I realized going through, especially on the family medicine, kind of general practitioner side of things, is so much of the care is kind of dictated by others, not really necessarily what you would hope to do for that patient or individual, or spend the amount of time that you would hope to build the relationship. So a lot of, what I ended up observing was a lot of the reasons that kind of doctors were wanting to get into medicine were being removed from them by the time they kind of went out into the world and wanted to practice. And is actually one of the big reasons why there's a huge shortage now of providers. If you try to find a primary care doctor, try to get an appointment, how long's that wait going to be? And then if you're lucky enough, how long's that visit going to be? You get to talk about like preventative, medicine. You get to talk about wellness. You have 12 minutes maybe. So you get to talk about one or two issues. And if there's not enough time in that visit to talk about them to address it, you get sent to a specialist, and then maybe you can have, that next set of issues discussed in the next 6 weeks, when you can get another appointment. So, I saw all of these different things, coming to a head, not to mention the fact that how do reimbursements work? They all reward illness. They don't reward wellness. They don't reward people actually getting healthy. All of the money is towards treating illness and throwing all sorts of different medications that you see on TV now. Like, people are trained to come in and start asking about these really expensive things. And so you kind of see the system is sort of built to reward a very few and kind of restrict access, increase cost to those who are actually needing to use it. And even now, if you're looking at the news, some of that's actually not working out for the insurers and things like that. So, I set out to kind of solve for that issue, to start rewarding, um, you know, people getting healthy and kind of reward wellness, create a healthcare system that, um, you know, and patients and employees can actually engage with, spend time with doctors, um, and really become healthy. And so that was what the direct primary care movement represented to me. And really since then, it's grown and grown and grown, created a health plan that now, employers across the country are signing up for. It's kind of escaped that traditional healthcare system. And so, you know, that's kind of where we've been. Really, that's how I met Jordan, really. And kind of we've partnered to bring this to, the Midwest, Ohio, Kentucky, Indiana, and beyond, really. So it's a problem that's in every state. And so it's a solution that everyone that knows about it really ends up, diving in on and being really happy with, because the alternative is just not a pretty choice.
Right.
One thing, Paul, that I think is interesting, he said state, and it made me think of this. People don't really understand how insurance is regulated. And the beauty of America, but also sometimes the difficulty in specific industries, is that we are so autonomous as states, right? Like, everybody kind of has their own thing. So what you find, and again, I don't ever speak red or blue because I'm not a big fan of either.
I'm not either.
Amen. So I think that, behind the aisle, everybody's holding hands anyway. And so once one gets the election, then they all agree to do whatever. So it's the same way from a state perspective. So if you have, a governor or whoever, it depends on who that person is that, decided to take healthcare, because there's a lot of different people that are in charge, quote unquote. So at each state level, it's really difficult to break through if they've already kind of had healthcare reform. And I only use this as an example because we live in Kentucky. So in the early 90s, we went through healthcare reform. I believe Hillary Clinton was Secretary of State. So most places have competition where multiple insurance carriers are in the state.
Right.
But here, there's one insurance carrier that writes over 80% of the business.
Is it Anthem? Or
Yeah.
it's Anthem.
Yeah, see? You're not even in it. Know that.
Mm-hmm. Yeah, they dropped me.
Yeah, that's interesting.
They dropped me. So, and this is what happened. So, let's see, they dropped me. It's been a couple of years ago. It was in December, I think, of 2023. So I don't know what was going on with Anthem at that time, but the is it called like the underwriter? The lady calls me and it's like it's time for I guess for them to review the renewal.
Yeah.
And so she's like, you got to list all of your medications and I'll turn that in and I hope that your plan gets renewed. And I'm like, you hope my plan gets renewed? Well, I'm like the healthiest. I'm 48 right now, but I remember saying to her, I'm like the healthiest 46-year-old woman I know that's, headed right straight towards menopause. And at the time, she had me list all of these medications, and two of them I wasn't even taking anymore, and one of them the insurance never even covered because many, many years ago, I was diagnosed with this rare bladder condition called interstitial cystitis, IC. Insurance companies do not recognize that as like a legit condition. So they won't cover any of the medication. And the only medication that ever worked for me was called Urabil. And it would range from about $150 to $200 a prescription, but I was able to get like a coupon through GoodRx. So sometimes I could get it for like $60 or something.
Yep.
And that's a medication that was always taken as needed. Insurance company didn't like that prescription on there, even though they didn't pay for it. There was another, and I'm going to sum all this up in a minute.
No, we didn't love it.
Was another prescription on there for another itis, perioral dermatitis. And it was, it's called minocycline, very mild antibiotic. When my face started to break out, I'd take a 50 milligram antibiotic, boom, it was done. I'd get a prescription for maybe 30 capsules per year. Another medication on that list was a statin, okay? I never wanted to go on that statin, but my doctor insisted that I go on it because my LDL levels were climbing. I instinctively knew I didn't need that statin. Ultimately, I ended up having a CT scan, and it showed that my calcium score was 0. So my arteries are as clear as cellophane. I never needed the statin. My HDL levels are perfect. They're better than perfect. It's 79. It's my HDL. Okay, so I wasn't taking the statin, but I had to list it. I wasn't taking the Urabil except like as needed. I've been asymptomatic from IC for 2.5 years because guess what? I made the lifestyle changes that I needed to make. I cut out all the acidic stuff, which that helped clear up my face. I don't eat tomatoes. I don't drink coffee. I don't drink wine. I stopped drinking wine. I loved wine. I stopped drinking wine. I cut all of that shit out. I started moving more because staying immobile is the worst thing you can do for IC. And so, and I'm not shaming or being an asshole, but it hits women more so than men, the IC. And the women that say, oh my God, I went to the ER, I was in fetal position, I was in so much pain. Okay. Well, they're not learning what to do. They're not learning what to do because you can manage IC. All right, Anthem saw all that. They didn't take any of that into consideration. And they ditched me and said that I had God, I can't remember exactly what they said, but the interstitial cystitis was ultimately the reason that they dropped me. Although they didn't pay for the medication.
Yeah. We see that a lot.
Is this a can of worms?
Yeah.
Everything you're
That's
saying.
That's a whole conversation on its own. Well, like what ends up happening.
We could all just totally rip that apart. And that's just like a small synopsis. That pissed me off.
Yeah.
I was like, you've got to be kidding. You all these insurance companies need to take a look at the person, not the prescription. Just because I have got one prescription a year for 30 capsules of minocycline because my face might break out a little bit, I don't want it to spread like wildfire. Okay, I take 1 as needed or 2 as needed. Just keep them on hand, which I really don't have a problem anymore. How can you possibly judge that?
Yeah, we see that quite a bit. It's like if you have a certain code they have listed, certain diagnosis, no questions asked. It's just associated with a higher risk profile, and
Yeah, they said I was higher
that's
risk.
it. Yeah,
Mhm.
it's all risk stratified, and
Mhm.
depending on what where state you're in, where you are, they'll just apply a risk score based on a diagnosis or medication that you're on, and then that's it.
Well, and one thing I want to add to that, Paula,
Yeah.
what you just talked about, it hit probably 7 different channels of how insurance works and overall healthcare for employers, which isn't healthcare for employers, it's the healthcare for the employees. But the majority of folks are on their employer's healthcare. So, our individual market is a lot smaller than what the group market is. So what you're saying is there's so many different directions to go. Like you mentioned pharma. Well, that's a huge conversation, and we could go down that rabbit hole for hours, but you ready for this? The top 3 pharmacy distributors in the country are owned by who do you think?
I don't know.
Would you be surprised if I said insurance carriers?
Oh, I did not know
And
that.
almost $25 billion in net profit last year?
Wow.
Wow. Is that weird?
Wow.
Isn't that?
That's a little
So
strange.
could they
It's a
maybe say
coincidence.
I'm
Right.
sure I'm sure it's
That's just a
It's a
coincidence.
coincidence.
It's purely
So
It
so
is.
could it also be a coincidence that the rebates that the pharmaceutical manufacturers give to those pharmacy benefit managers are tied to a specific drug they'd rather promote than a generic? Could that it probably doesn't happen, doesn't?
Probably doesn't.
I don't think so.
I don't think it
I
does.
think
But
you just got crazy ideas.
to bring us back from the rabbit hole,
Unbelievable.
because health insurance is the umbrella that people say, but I'd like to put this dude on the spot. What is direct primary care? What is a wellness plan? What is an employee assistance program? What is health insurance? What is Aflac, right? I'd use that because everybody sees it on TV, right? But that's an indemnity-based product that's paid directly to the employee.
Mhm.
Who do you think should be making their healthcare decisions, the employer or the employee,
Oh my God.
right? So I don't know if you want to start, but
So many people don't get to make their own decisions when it comes to their health. It's ridiculous.
And that's really, that is really one of the core reasons why we created the health plan that we've come up with called the WOOP Care Health Plan. And so really,
there it is.
yeah,
Right.
really, the entire purpose of it is to is to restore that choice back to the patient, back to the employee in a shared decision-making process with their provider. Give them the time, give them the resources to be able to. So for example, in the situation you had, you were like, trying to get different medications, something wasn't covered. You still needed it. Insurance said no. Even if they were going to say yes, you probably would have had to have jumped through several hoops. We've seen that from the provider side, and essentially designed a health plan that says, okay, if a patient needs something and we as the providers of the health plan, agree that's medically necessary, like we're here, hand in hand with you, the patient. If we think that's a necessary treatment, we approve that. We don't have, it's our plan. It's our health plan in partnership with that employer, with that employee. We get to make that decision on our own. We don't have to go to somewhere else and get an approval, oftentimes, prior authorizations, things like that. We can make these decisions ourselves between the two of us, provider, patient, and just do what's best for you. And the kicker to it all is that when we do that, we can do that in a way that's no out-of-pocket cost to the member, to you, the employee, in most cases.
So to take that, I'm going to take that to the nth degree, though, right? You know this. Who are you calling? The carrier, right? You're not calling a provider that can understand how to speak the language of the carrier. So you heard him talk about CPT codes, which stands for current procedural terminology. I don't know, that word's hard. Those codes dictate what's paid back. So they're going to steer you, just like wink, wink. We were talking about the pharmacies. Like they are trying to build a package. Like you said it earlier. It isn't that it makes you unhealthy. It's that it maintains, hopefully, where you're at.
Right.
And you've heard maintenance drugs, right?
Oh, yeah.
So insurance is no different. So he was talking about primary care physicians. Like, and you brought this up about women. How many men do you know that have seen their primary care physician within the last year. Probably
It's pretty rare.
it's rare, right? So they always do what? And I know we're being generic here, but like they say, I don't know, my wife handles that. And it's like, I don't need to go. I feel fine. Well, dude, your leg is green and it looks like it's not. Well, no, I'm fine, dude. I'm fine. So, given that that's the scenario, if you had a safe place with a doctor, because sometimes the primary care physician's your friend. And just like in businesses, you already answered it. Employers shouldn't be making those decisions because no employee is going to go into an HR manager or their boss and tell them that they drink a fifth of vodka, they're fighting with their wife, this happens, their child is autistic. Like, they don't want to share that.
Well, of course not.
Right? So that's where primary care really matters. And I love what they've done because how many doctors do you know that just said, hey, the system's broken. I'm not doing this anymore. I have a fiduciary responsibility as a doctor to do the right thing. And I'll hand it back to you but my father had a heart attack, I don't know, 11, 12 years ago, whatever it was. And thank you, Jesus, he's still here. But his own cardiologist, who shall remain nameless, told him, bro, if I don't write scripts, I don't get my bonus.
Oh, my God.
So I have to write X amount of scripts every month. And this is a guy that's making $850,000 a year.
Sure.
And he's like, I can't go down to $450,000. And the only way I get to $850 is if I do what they tell me to do. So I'm recommending something that maybe the doctor doesn't even believe in.
Right.
Yeah, that's unfortunately that's sometimes the reality of that side of things. There's a lot of conflicts. I think there are laws in place that have tried to eradicate a lot of that behavior, but it's definitely prevalent, or it has been in the past.
There's a human component too with what you guys are doing. And this is just outside of the health insurance piece of it. The human component comes from employees know when their employers care.
Oh, yeah.
And when they don't. And I walked away from my employer, I call it the W-2 world, in 2015 because I knew that I wasn't appreciated. Nobody was. All of us, it didn't matter what we did. It's like we were replaceable no matter who you were. And so I have managed people throughout my lifetime, and I always tried to never be a manager, but to be a leader and to try to get to know each individual. Well, what's healthy for one person might not be for another. Nobody is the same. We are all individuals, and what works for one person doesn't work for another. For instance, I have designed my entire life around my sleep schedule. I am not a person who can get up early. I've tried. It makes me feel horrible. And so I have to be able to sleep when my body wants to sleep. It's an individual thing. And when you have an employer and an employee who are in a collaboration with the employee's health, that is huge. That is huge. And you don't want to have a bunch of sick people working for you either, because then what happens? Everybody's calling in.
Missing time, getting sicker.
Exactly. And it spreads. It just spreads. And the next thing you know, everybody's pissed off because they don't feel good.
Yeah. And then how do you fix that?
Right.
Give people something where they can spend time with their providers.
Right.
They can actually have a preventative wellness plan. They can have someone checking in on that. Because when you're if you're in an arrangement with direct primary care, suddenly the incentives are not just to get paid to treat illness, to push illness along the chain, the referral chain, specialists, so forth, so forth. You do that when that's the right decision, but that's not the incentive, because there's incentives in every single system, right? There's a reason why, primary care providers have very little time to address complex patients. It's because you have to send them to the specialist. There's more billing coding. You send them up the chain. That's how, many of these large systems generate revenue. They have to charge these, these more expensive codes. Those patients are representing ways to really extract those funds from the health insurers, from the carriers. And so if you have a system where you just have a set cost per month, you can spend as much time as you want with a provider, talk about whatever it is that you want to,
in confidence.
Yeah. And basically just set the foundation for your health and wellness. And then check in throughout the course of the year, make sure that you're on track with your goals. and then address the issues, the acute issues that come up, the illnesses, those sorts of things as they come up, but then always having, that provider focusing on your goals, your wellness. And that's just what's been missing. And then we've had to, really build into these health plans. And so when an employer implements that, the employee really senses that this employer cares. You suddenly have this benefit that now, I've never even experienced something like this before, where I can, have a next day visit with a doctor for over an hour, talk about whatever it is that I want to. I mean, one of the things that I've seen kind of emerges, and you've probably seen this on different, social channels, is that there's a lot of, push for longevity medicine, a lot of different things that are kind of coming along. And I will say, a lot of the guys that used to just ignore kind of primary care, they're starting to kind of get in tune with these, because they're getting bombarded on, the Instagrams and things like that. So they will they're calling in greater volume now. It's saying, hey, I've heard this person on a podcast, or I've heard about this particular peptide or whatever. I kind of want to learn more about this. And that's kind of the gateway for them to start taking control of their health. And so once that ball gets rolling, a lot of these guys have been ignoring their health, start getting their annual labs. They start just checking off the very basic things to then focus on what their goals may be, and kind of really not just going to be healthy, but longevity and that kind of, because now if you have the time, if you have the resources to do that, if you have an employer plan that kind of rewards that, then it's all achievable. It's just, is that a priority, or is that not really? So we're seeing that really come to the forefront.
Well, as generic as this sounds, like your awesome book here, whatever you think you are, you will become that.
Oh, God, yeah.
Right? It doesn't matter. You will become it. As long as you consistently think it, that's what you're going to become. And as men, and I remember I used to get mad because people would say, you're metrosexual. And I'm like, what? I like girls. And they're like, no. And I'm like, I got a lot of gay. I'm like, as men now, we're more accepting of hey, I can have the longer hair, whatever, joking. But we are a little more in touch with our feelings than maybe our dad was, coming from a almost 44-year-old guy. Does that make sense?
Oh, yeah. Well, what was the comedian that we watched that talked about how men just drop dead? Was it Bill Burr?
Yeah, that was Bill Burr's last special.
He said, if you notice, he's like, you'll hear this story, about your friend. And he was like, I don't remember exactly what Bill Burr said, but it's like, he was, 56 and he was dropped dead. And then you'll hear somebody, they just dropped dead. And it's because we're taught that we cannot show anybody how we feel. We have to hold it all in. And that's why men just drop dead. And it's it was hilarious to hear him talk about it, but there is truth to that.
100%. But like it says, we have to convince people to not think that anymore. And to Dr. Mike's perspective, that shift has already happened. And what we're struggling with, and this is not a knock on employers. I onboarded 500 employees and had to offer healthcare in the restaurant world. That's a really hard place to do it, because we know business, right? We know that it's typically a cash flow game.
Right.
And some businesses won't survive if they don't have that cash flow.
Sure.
EBITDA is great, but a lot of businesses don't operate in the black. It just is what it is. And what we're finding is these employers are, we think, we're not being judgmental, but we just feel and this is what you're excellent at, wellness is not for the healthy people. They already know how to do it.
They know how to do it.
Right.
They're
and
not
it's
getting into crisis mode.
Exactly.
They're not landing at the ER when they're already dying.
Exactly. And all these employers are going, we need to implement a wellness plan. Well, that's great, but the people that utilize it are the people that are already doing it. They're just doing it for the $250 gift card to Costco, or they're up to, as ACA states, healthcare reform, up to 30% discount on the premium. That's the only reason they're doing it. And this is the sad part. The people that are unhealthy, they don't know that should be designed for them, and no one's telling them to demand it. Does that make sense? Everybody, you said I can cuss, right?
Yeah.
Everybody just bitches about healthcare reform or Obamacare or whatever. I'm like, dude, that was Obama's great. I like him, but he didn't do that. That was already happening. It was just a good way to get it passed and pushed through.
Exactly.
And the long and short is we needed healthcare reform. I mean, here's a doctor telling you it, but I just fully believe, which you're passionate about too, we need to find the people that need the wellness. Someone like you've already went on that journey.
Yeah.
And that's what is not being educated, in my humble opinion, on the employer workforce front.
It's not.
They're not telling their employees anything, and they're definitely not giving them time to do it. But COVID, we do teams at home, and everybody's got remote work, and nobody works on Thursday and Friday anymore because they're at home with their dog and their kids, and the cat's in the video, and it's fine. And I'm good with that because I think the family is important. But why are you not starting with healthcare? Because an unhealthy dad can't be there for his family or mom, whatever.
No.
But it's like, your health is everything.
It's everything.
Everything you got.
It's everything. And it also ties into conscious creation because, and I used to stay sick all the time. I used to not be a healthy person. And you're looking at somebody who absolutely transformed, her health.
I've seen her in the gym before. She works hard.
Charlie killed me yesterday. My legs are so sore. My legs are so sore today. Oh my God. He killed me yesterday. But I turned everything around, and it wasn't easy. I mean, it just wasn't. But what was going on with me is when you don't feel well, you get irritated.
Yeah.
You're worried. Your health will worry the daylights out of you. And worrying is the exact same thing as praying for what you don't want. And there is a such thing as energy, and every emotion is connected to a vibration. And so if you're running around and you're irritated all the time and you're pissed off and you're mad and you're sad and you're worried, and that goes on day in and day out for several months or several years, well, guess what? You're going to attach to other vibrations that match all that. Money problems, relationship problems, toxic work environments, more health problems, unexpected events, car accidents, flat tires. You walk out the front door, something stupid happens. You can't go to the mailbox and back without something dumb happening. And I lived that for so many years. And I heard Dr. Wayne Dyer, and he's the first person that actually helped me connect the dots. And I'm like, oh my God, so I'm not a victim, and I can be in control of my health, and I can be in control of this, and I can be in control of that. And that's when I started getting in the driver's seat of my health instead of really letting the doctors do it. I don't care to tell the doctor no. And when I was put on that statin, I didn't like it. You can ask Will. I was on it for a year, and it pissed me off. Like, I don't want to be on this, and I kept bitching about it. And I told my doctor, I'm like, I'm getting off of this. And so we did my blood work, and my cholesterol was perfect. And I'm like, I'm not taking this anymore. It was that kind of thing. Whereas, 15, 20 years ago, I'm like, oh, I got to do whatever my doctor says to do. I have to do this. When they don't know me, I do.
Yeah. And really the best way to go about that the most effective relationship in terms of patient-doctor is to not for the doctor to just be dictating what you need to do. It very much should be like a shared decision process where it's like, you're the one that has to take these medications every day if you're going to. Let's talk about what that looks like.
Right.
Maybe that is just it's a non-negotiable for you. Maybe there's something else that can be done. So that's kind of when you have the time and you have providers that are kind of willing to sit down and like hear each story, where you're coming from, then that doesn't have to be such a combative relationship. It can be more collaborative, and you can probably have a better experience that way when all of those things are there. But unfortunately, most people don't have that experience. And so it's kind of like you have to take the reins over your own health. And,
When I was in perimenopause, I learned so much about the stages of menopause and postmenopausal now. Menopause will rip a woman's health to shreds. And when I realized what was going on with me, it's like I woke up one morning and somebody showed up like a thief in the night and just took my personality. And my hair was thinning, and I didn't look the same. I didn't feel the same. And then I nailed it down, and it was perimenopause. Well, my gynecologist at Norton Healthcare said, you need to go to so-and-so because I can't prescribe what you need. They won't let me do it, but this is what you need. And it was hormone replacement therapy. So we pay for a concierge doctor on top of health insurance, which the health insurance will pay for the concierge doctor. So I can go in and get what I need. They saved my life. And I spend 30 and 45 minutes with Pam. I call her Pam. I mean, she's my doctor. And it's like a whole other thing. But when women are in those stages of menopause, if they don't know what's going on, most doctors don't talk to you about that. My doctors never talk to me about that.
Unfortunately, there's been, I think now, a couple generations of women that have lived without really the option of hormone replacement therapy.
My mind.
And a lot of doctors have been scared away from it based on
That study that's not even valid.
Yeah, it's like there's some questionable research that kind of became really kind of
Blown completely out of proportion.
it became kind of just the general guidance for most doctors, and it's really not well founded. And only kind of in the last few years, decade or so, has kind of a new kind of generation of doctors looked back into that and said, actually, we're improving more lives than not. The cost benefit here is really weighted into the benefit side. Obviously, it's individual, so it's case by case, but by and large, it's been, when, properly monitored and administered for the right type of patient, it has the result that you allude to.
Absolutely saved me. And that's when my eyes really opened about the relationship between health insurance companies and doctors. And she was my favorite doctor at Norton, and she retired. I don't blame her. But she was the only doctor that ever sat me down and said, let me tell you something, and she broke it down and told me who to go to. And I will be grateful for that woman for the rest of my life, because otherwise I wouldn't have known. I mean, I would not have known.
Yeah.
So I just wanted to throw that in there for any women who are watching, because people don't talk to us about menopause, and it's inevitable and it's horrible. But if you get ahead of it and you're informed and you're educated and you know what's going on, then it's not a death sentence.
No.
Yeah.
Can I ask you a question on the concierge? How did you even know what concierge was? Like how did that come about? Was it like a person you met? Like how did you know to go do that?
So someone that I used to be friends with said she and her family used a concierge doctor. And I was like, what's that?
I mean, different ways to say it, right?
And I'm like, what's that? A concierge doctor, what's that? And she said, well, they don't take health insurance, but they will do things that other doctors won't. Like they'll order tests for you and they'll do things out of the box. And I'm like, well, that's interesting. And then when I talked to my gynecologist at Norton, I realized that that's exactly what she was describing. So that's, long story short, how I found out, because I didn't even know those types of things existed. I mean, I thought it was just the way it was.
Yeah, and now every employer can have it.
What I love,
it's come a long way, and it's really what you're describing is personalized medicine.
Oh my God, it's great.
Like what you were experiencing before was kind of the one size fits all type of medicine. Everyone kind of goes through that same process, and then concierge is different because it's it's tailored to you.
Right.
It's tailored. Everyone's an individual. Everyone has, they're in a different place. Some things are similar, maybe baseline labs might be similar, but the whole journey is going to be different based on what your goals are, where you're starting from. And so that's kind of what you're paying for, is that personalized experience. And so if you can build that into a health plan, it's kind of a game changer for everyone. So it's more than just someone having to find out the way you did. Bring it to employers as a whole is kind of, imagine the impact we can have if we did that.
It would change the world.
I mean, legitimately.
So how do people so would you kind of walk me through, if someone wants to incorporate this into their corporation, how does it go? What happens? What do they do?
Yeah, so there's really two ways. One way is really reaching out. It's really reaching out directly. You can go through, actually there's now multiple channels. They can reach out, to myself or Jordan directly. We have, several websites actually. One's WOOP.care, also on the OHS website.
Healthy Worksite.
Or WH.
Healthyworksite.com is another. And really the way that we work is because it's an employer geared solution, We work directly with, health insurance brokers, health consultants with their clients. We are a health plan. We're there to actually work with, the existing, group of consultants or consultant. We're not, looking to ever, really displace anyone. We're there as an added benefit. We want to kind of bolster what they do, make their life easier. And so when employers are interested in this type of solution, really the one of the things they could do is either go directly to our site, inquire, ask their broker will then tend to inquire with us. So there's multiple ways to do it, but obviously directly works, and then we connect with their brokers as well. Also, the way that you found out, we have a retail channel as well, so
Yeah.
we do retail, employer based, and so really there's multiple ways to get to us.
Okay.
As cliche, Paul, as it sounds, we would like to be like the Amazon of health, because I don't understand why a doctor like this couldn't prescribe you to read that book.
Exactly.
Right. And there doesn't need to be a reimbursement or a kickback or whatever, but it's like
meditation, primordial sound meditation that I teach is backed by science.
100%.
It reduces inflammation in the body.
100%.
That's something, come on, people.
100%.
It should be covered by insurance.
It should be. And so because of the reason you just said about going to a concierge medicine and saying this makes sense because of that wonderful doctor, was her name Pam or was the new doctor Pam?
Pam's my current one.
Yeah, the current one, but the lady who told you wasn't Pam.
No, that's not Pam.
Yeah.
I'm afraid to say her name. I don't want to.
I know. I think about that. I'm like, oh, who
She's
watches
employed.
this? But the point being is doctors are for that very reason. It's sad that you and I even have to say that.
I know.
Like, why would they get fired for doing the right thing for their patient? They're a doctor. That's why he went to school forever.
Yeah.
So, like, why would he not be? Well, he can, because the system is telling him, who is 9 times out of 10 probably not ran by a doctor.
Right.
How many hospital administrators are doctors? Maybe less than, I don't think they are. Point is, when you think about health insurance as a whole, there's really 3 main ways after healthcare reform to get it. You're going to get it through your employer, you're going to get it individually, or you're going to go to what they call the exchanges, right? So how in the heck do you know how to do that?
Right.
Like, how do you know how to do that? You're a very educated woman that has been on this journey.
I don't know about that.
You don't know about that, but how many years did it take you to even get to where you're at?
Oh my God.
Right?
Trial and error.
Exactly.
The first 3 decades of my life. That's for sure.
So all we're trying to do, is make sure that everyone can access this and just have the knowledge about how it works. So like, we get pushback a lot of times from business owners, right? Let's say you got 250 employees and the business owner's going, well, we already have Teledoc. Okay, let's define that. You have an iPhone, but you can't do what some computer programmer can with his iPhone because you haven't been educated how to do it. It doesn't make him smarter and you less smart.
Right.
No one's just shared how it works. And like, my lovely wife would make fun of me, I'm sure, but I always say, I don't care what time it is. I want to know how the watch is made, right? Because then I can really understand what watch I want to buy.
Right.
And when it's you and your body, Bill Burr dropped dead at 55, like, well, you know what I mean? Like, wouldn't we want to change that? There's a reason a comedian's saying it, but the second we start to bring it up, 2 things happen. And some brokers are going to be mad at me, but oh well. The brokers go to what they know. But they are typically educated by carriers and carrier reps who are not educating them on alternatives because they're employed by this thing.
Right.
So like I told you, one company is handling 80% of these decisions in the state of Kentucky. You tell me that that's what capitalistic America was designed to be.
Right.
It's not.
Right.
And so now we're the competition. So the carriers are going to immensely hate us. The brokers won't, because we're trying to do the same thing the carriers are doing. But right now, they're making too much money with these folks. So when we come in, they're like, get the hell out of here, dude. And I'm like, whoa, you're a broker. What does that mean? It means that I get you the best option as an employer. And so the way that Mike has created it, I'm humbled to be a part. I mean, they had this thing going before us. Dave had this going since 93 with On-Site Health Solutions. I've been on the indemnity-based insurance side, which means we pay you directly, employee, not employer or a network or a provider. It's indemnity products. So all 3 of us have been a different leg of the stool, and there's multiple legs of the stool, but these are 3 big ones that I think we can really change healthcare with. And we want to say to brokers, carriers, whatever, but we want to say to brokers, dude, we can work with you anyway, and you probably are going to make more money, because what happens when people get healthier and understand what wellness is, they start adequately preparing for their preventive coverages.
Right.
So they spend more money on products like that. So all we're really doing is, like you said, not giving you coffee, we're giving you water because the coffee did something for you that didn't work. So now, like you get to do with your concierge Dr. Pam, it's for Paula, because Will's a cool dude. He ain't made up like you at all. Even though you live in the same house, whatever, he has totally different needs for his body and his physical health. And even with me, I'm a man, but I'm different than him.
Right.
Genetics, whatever. And it's like the fact that employers don't think that they need to help their employees with this, and that health insurance isn't one of the biggest pieces of what they can give an employee, then why is it their number one line item? Why is it their number one expense?
Right.
Just saying.
Yeah. I mean, and not to mention the cost with it as well. I mean,
Yeah.
you said it's usually the second or third largest line item. And that cost, as you know, it's like in the news every other day. It's going up and up and up and up. So if you're living in a world where employers are required to provide this, and you also live in a world where all the prices are different based on where you might go within the same town, it's an unsustainable picture unless you have something in place that can contain those costs more or less, in a way that also expands access, gives people choice. That's basically what we've built, is a way to guide members through the healthcare system, holding their hand, expanding their choice, doing it in a way where they have nothing out of pocket. Really, like all of the things that you would design if you said, how do I build the best plan for an employee? Basically built those all the way through. And then if you do the right thing by employers, you actually end up saving them a lot of money along the line too, while kind of delivering on all of those items. So when we actually, at the end of the day, compare the costs of running these plans versus maybe what is in place already, it's like night and day. And all we're really doing is doing the right thing for those employees, for those patients. And it's funny, that extends past health plans. It extends to, what you do every day, is if you actually just do the right thing by people, it really tends to just work out in the end. It doesn't really matter what you're doing.
Let me give you a real life example that I think will resonate with you. We have a client that is a client in another area. We brought them a pharmaceutical option. So they were okay with this side, but we brought them a pharmaceutical option and just said, hey, look, we can import this from Canada. Now, everybody's going to go, well, that scares me because Canada, first of all, we're not going to cut anything off of Canada. Like, we have like professional sports teams in leagues that are headquartered here, that are there. People travel all the time across. Like, it's completely different than Mexico, whatever. I don't care if you like Mexico or Canada or not. It doesn't matter. The point is it's a very developed country that has nationalized healthcare. Every country in the world has some type of socialistic medicine. And I won't even use the word socialist, just call it nationalized. Like, it doesn't matter. Don't get all bent out of shape because it's, socialism. That's not what it is.
I know what socialist.
Exactly. So in America, we are the only country that doesn't have a nationalized health system outside of Medicare and Medicaid, which Medicare is only for people. And I think Medicare works halfway decently. I think it could be something they could expand, but that's a whole nother podcast for another day.
By my mother.
Yeah, it's decent, but it all boils down to education of how the watch is made. So we could buy, and you've heard Trump say it, like him or not, I don't care. He's right in what he's saying about why does Ozempic cost $1,500 in New York and $500 in London?
Right.
Why? Same exact drug made in Buffalo, New York, ships to London, ships to Toronto. I can buy that in Toronto for $500 and direct ship it to your house so you don't have to go anywhere.
Right.
And it's the same exact drug. Why would an employer not give an employee an option for that?
Exactly.
So we're going to the employees and we're saying, hey, you're paying, respectfully, what you said, $150, that ain't nothing. Some of these people are paying $1,800 a month on a $70,000 salary.
Oh, I know.
Like, it's insane. So we can go in and not provide a generic, import the exact same drug and have it shipped to their house because we went through a different distributor. And we have one local group here. They saved $1.4 million and didn't want to implement it. So to Dr. Mike's point, it isn't just helping the employees. It's taking that bottom line and it's removing all those catastrophic events and different things because we're giving that medication. Because I'm not saying they don't need it. A lot of people need medication.
Oh, absolutely.
100%,
100%.
right? I
Oh,
love
yeah.
doctors.
Oh, me
But
too.
we give it to them, they take it, they get better. That saves your plan long term.
Mm-hmm.
So if that employee stays there for even 2, 3, 4 years and that stroke or heart attack or cancer diagnosis doesn't occur because we did the preventive,
Right.
the employers should be doing this left and right
Yes.
because it's financially incentivized
Yeah.
for them to do so.
Mm-hmm.
But because of the structure of the brokers and the carriers and the way it's distributed, they went to high school with their broker and they're like, well, he's been my best buddy. I had one broker that I worked with. He would go into groups and he would say, hey, on a handshake, you told me your buddy that you went to high school with or frat buddy or whatever, he's quoting you with all these different insurance carriers and dividing you the best option, correct? And they'd be like, of course he is, man. That's my dude. And he'd say, on a handshake, have him quote, at the time Humana was in the business, have him quote Humana. I'll go get the same quote from Humana. See whose price is lower.
Mm-hmm.
It's kind of like if you know somebody owns a car dealership, my buddy's going to give me a deal, right?
Right.
Probably.
Probably.
But is he or is he not? And I'm not saying that all brokers are like that because they're not. There's wonderful brokers. But I'm saying that the ones that are great may be uneducated, that there are alternatives. So we've structured this so employers can call us directly. But if you're already working with the broker, we'll pay your broker. They'll probably make more money than they're making with what they're doing. And what I find, though, and this is what blows my mind, people won't even meet with you. And I'm like, why? I mean, isn't that like what a broker's supposed to do? Shop the marketplace? But they just say, no, we don't. We're not going to do that.
Change.
Yeah, there are a lot of other things at play with dollar signs on them that kind of control that, either, that inaction or the old habits, more or less. So, but there are enough kind of newer, enterprising, people in that broker community that are interested in doing, not even necessarily the right thing, but just exploring what's out there, because this is constantly changing all the time. And getting back to what you said about specifically referencing like that GLP-1 issue, if you take that one step further, yes, there's the cost issue. There are ways to import it. Those are, kind of all things that we know about that we can do day in and day out. But the other thing is, say you can get it for half the price or whatever the price is. The other part of that equation, if you take it to the next level, is, okay, we've got this drug, but now do you have the relationship with your doctor to actually drive the lifestyle changes, the wellness changes, so that does not become a forever drug to you, doesn't become a forever drug to your employer be on the hook for? Because these medications, as Jordan said, are, they have their place and they're necessary in specific use cases. That's why they're here. They, help people improve tons of people's lives, lost, lots of weight, things like that. But generally speaking, there is a population out there that doesn't necessarily want to or need to be on them forever.
Right.
And then it becomes a cost issue long term. They don't necessarily need to be a fixed cost in your life, or your employer's life. So in order to achieve that and to kind of get off of those whenever the time is right, if that's the case, you need to have that relationship in place. Do you have something that affords you that? Do you have that trusting relationship? That's where, once again, everything all roads lead back to that relationship with, primary care, direct primary
With
care.
Pam.
If you have,
Yeah.
with Pam, I'm going to call, it's not going to be DPC, it's going to be called Pam.
Pam.
All roads, so imagine,
Look at this Pam
imagine
thing.
all roads lead back to Pam. Like, that is really,
Maybe this will get her on the podcast.
Yeah.
Come on, Pam.
Because I want her to talk about mental walk.
all roads lead back to her. Wherever you go, the answer is, is really back to that kind of home base, that medical home. And so everyone needs that. Even if you are healthy and you are well, maybe you want to live longer.
Exactly.
So do you want to have the time, and do you want to talk with a provider that can have that discussion?
Mm-hmm.
So that's what our providers are trained in. So when we have those healthy members, they're like, my numbers are fine. I don't have any complaints. I don't need this, whatever. We have the discussion of, okay, do you have any health goals? Do you have any longevity goals? Who's going to say they don't? I haven't met anyone that hasn't. There are, that's a different scenario. But people have goals whether they realize it or not.
Sure.
And so it's just about giving them the environment to explore those, to create a plan, to execute that. That's just something that they don't even know exists until you kind of come along and start implementing that.
So how do employees, just so I can get my head wrapped around this, so how do they pay for their health insurance, you call it policy?
Yeah, so
Okay.
the beauty of what we do is it functions and operates from a, financial perspective, really the same way that any other health plan does. It's a monthly premiums, employer contributes, an employee may have a portion they contribute. It's all built the same. The only difference really is the deliverables. You're getting that direct primary care, you're having the care navigation, so you're being handheld really throughout the whole healthcare system. You're never, as a member, going to be left to your own devices to kind of make a bad decision, do something that might result in a massive bill. We're there holding your hand through the whole process. And the reward to that is not only just having a good experience in a system that's stacked against you,
Yeah.
but it's also that ensures that you don't have any out-of-pocket costs along the way. So it's really a win-win for everyone. And the thing that I like to really educate employees on when we present the plan to them during open enrollment is really it's a no-brainer, because if you don't have any healthcare needs, generally opting into our plan is going to be the cheapest option. It's just the way that the underwriting and the pricing works. But if you are, worried that maybe you have a diagnosis that you're concerned about, or, if something were to happen down the line, you would probably want a second opinion, hand holding through the system. Because when I've, observed people that have encountered these, catastrophic diagnoses or need some special surgery or treatment, they are looking for hand-holding, they're looking for guidance, and so
They're scared to death.
all we're saying is we're going to extend that olive branch in the beginning ahead of time, and then take you down this journey through the year. If anything happens, we're already there for you. You don't need to scramble or wonder, "Who do I need to talk to?" We're already there. You already know us, you already trust us, we're in place, and by the way, the cost isn't going to scare you because it's already part of your health plan. So yeah, that's kind of the beauty of how it works. Once again, it's what's the best possible plan for an employee? And then we just built that out.
To further
You
your
have a real superpower. I just want to say this real
No.
quick, or I'll leave my mind. You have a real superpower because not many medical doctors also know about health insurance and then get into the role that you're in. I mean, that is really
One
It's
of the
wisdom.
things, yeah,
that's gravitas, as Dave
Well,
Bergmeyer would
you
say.
have to,
A doctor's telling me how insurance
you
works?
have-
Whoa.
yeah, I think you have to be, for better or worse, like a little different. There's there are a lot of forces at play that kind of push doctors into, going through the process a certain way. We've all had like very different journeys. Mine is for sure different than most. And really, I've been just able to kind of like there's really a wall between, doctors, physicians, providers, you name it, and then the business side. Like no one actually knows what anything costs. Like if you go to a doctor, they don't know. They order an MRI, they have no idea what anything costs. No one knows. That's on purpose, right? And so when you experience that over and over and over again, and maybe you're a bit entrepreneurial, maybe you're kind of a bit more inclined to the business side of things, and you are more of a risk taker. Trying not to like, disparage myself too much, but yeah, if you're a little bit geared in that way, you get curious, you start asking questions, and then you start finding, better ways to do things, and then finding other people that are that way too. And then you put all those together over time, you build something like this, you start learning all the things you were really never supposed to know that would prevent something like this from existing.
right.
So then once you start learning these things, you can't unlearn them. It just makes you more curious to keep learning, keep finding more solutions. And in this world, there's so much that's ripe for disruption but not for just the sake of disrupting. It's for the sake of making people's lives better. And right now, status quo is so far slanted against that there's just so much potential and so much opportunity everywhere you look if you're trying to do the right thing.
Sure.
So
Well, you asked, I think, at the beginning of this question, I want to add a couple, that was great, but I want to add a couple clarifying pieces. How do they pay for it, right? I kind of told you those three ways. There's really not three. I just brought up the exchange because it just added a different layer. There's really only two. It's either group insurance or individual policy, right?
Okay.
So how do they go access that? Well, I use the Amazon example because Amazon really didn't do anything other than aggregate logistic companies long term. I mean, they did a million things, and I'm utterly impressed by Mr. Bezos and all that's going on. I'm not saying that. I'm just saying they have existing vendors that were already shipping and delivering in cities, and then they just kind of gave them a little rake because they said, we can provide a lot more orders you didn't have before. Does that make sense?
Yes.
Sort of.
I understand group plans and the individual plans, but the exchange is what I really don't understand, I guess.
So, I mean, that's a whole nother podcast, but so this is kind of the simplest way I usually explain it. When healthcare reform happened, the last Chief Justice that voted it into law said that it's a tax. But when you hear on Fox or CNN or MSNBC, I don't care who you listen to, like when you hear, they call it a fine. So you have 50 employees or more, you have to offer health insurance or you will have to pay a tax.
I was getting ready to ask that question. Okay, so it's 50 or more. Okay.
Yep.
Okay.
So 50 employees or more, and so all of them have to do it. So if you really think about it from a governmental perspective, what were they trying to do? It's audit power. So if they're requiring us to have health insurance and they're making employers do it, clearly they have big time relationship with carriers and all these other things. So it's a revenue driver. So now when they go audit it, you just go to the employer and say, prove all 50 employees have it. And if they don't, then they pay the fine all the employees. You see what I'm saying?
Yeah.
So it was just an easier way to get that tax back, but they call it a fine, but they don't. It's a tax.
Okay.
So either you're getting your health, the simplest way to state it, Paula, is you're getting your health insurance through your employer or you're buying it on your own. And you're finding now that, especially as the gig economy grows, those two worlds are starting to blend. Like, what does that even mean? And what I love about what we do and why I call it the Amazon is, shoot, we can go to Florida where the laws are totally different. We can go to Alabama where it is only Blue Cross Blue Shield. There's nobody else that offers health insurance.
Really?
Mm-hmm. So we can go down there to Alabama and provide them an alternative for business owners that potentially want it. Now, there's red tape at different state levels, but I feel like we have built our widget to where it's actually sometimes upfront less, but let's say it's the same as your health insurance. We can show you with data because we haven't written tons, but we have over 200 groups and have been doing this over 8 years. Well, they have, and you've been there probably 3 or 4. There's a whole nother team obviously behind it. It isn't just these two brilliant dummy, but they're, it's just not these two little minds that form the rock pile. There's a lot of doctors and really intelligent people behind this. We just get to be the distribution arm of it. But when we go in, 2 to 3 years, you're definitely going to save. And on 200 companies, we can show you the data. So I don't know who can argue with that.
Right.
But the point is what I want you to hear and understand is, I'm not shamelessly plugging your book. I do think that could probably change somebody's health.
Absolutely.
100%,
It
right?
100% could.
We talk about mental health every day, all the time, and we didn't talk about it 10 years ago,
No.
right?
Mm-mm.
Not at all.
No, people are embarrassed. And it's it shouldn't be, there shouldn't be a stigma
Not at all.
at all. People don't think anything about going to the little clinic if they have a head cold or whatever. But if something is going on mentally, it's like there's a shame attached to it or something, and that shouldn't be the case.
So just to wrap that part up, because that was a great question. What I love about what this dude has done and the care team and all the awesome doctors and NPs and all the people behind MedTech, whatever they are, like they're way more educated from a provider perspective than I am. But right now, you go tell me about any health insurance plan out there and tell me where you have this built in.
Right.
And then what they lead with is, hey, Paula, this is the wellness plan.
Mm-hmm.
What are your goals? And it's almost like they become that counselor. And just like you said about Pam, did we prep you for that? We did not.
No, not at all.
You said it.
No.
So you've got 20 Pams you can talk to.
Yeah.
So all of those employees can now go back and say whatever. But what's great is the way that their team has trained it. They're leading with what are your goals? Not what should I do for you? Now, there's triage on things that could be catastrophic right away, but 85% of the employees fall into this. An ounce of prevention is worth a pound of cure. So if we can get 16 ounces of that, then now we got a lot of pounds. You get what I mean? And it's like, that's what they lead with. It's not just health insurance. It's so much more than just health insurance.
Yeah. And not to like make it all an insurance, focused talk. Insurance, it can, bore the heck out of anyone. But really, when you're talking about all of this, it does all boil down to cost, to the money involved, the budgets, all of that. And really employees don't really have a choice where, they pay their premiums. Where do those dollars go? When they need care, where do those dollars go? There really should be a plan and a system in place that guarantees that the dollars that you spend, whether you're the employer, or whether you're the employee, actually go to your care. That you don't want them necessarily going to layers of middlemen, administrators, people that are processing claims, collections, billing departments. The ugly side of this is that if you bake in all of those costs, like 20, 30% of what is being spent on healthcare is just going to to what is basically middlemen.
Right.
So when you go into kind of like a solution where, more of like a self-funded solution, like what we're doing from the WOOP Care side of things, those dollars are going really directly to your care. So it's a much more efficient spend of those dollars. No longer is that 20 to 30% just going to people who are in between.
Right.
So when we get into an employer group, the savings becomes almost immediate because that 20, 30% is no longer being wasted. And then we do the things that Jordan mentioned as it relates to prescription drugs. We might source it from somewhere like Canada or the UK for that Mounjaro or whatever it is, that GLP-1, that's half the price.
Right.
But, is, by the way, when we do that, it's no cost to the member. And so when we're able to kind of do that, it's just massive savings. When each dollar is spent on actual care, just that makes a massive difference. And that's why the data is so strong. When we have experience with the group for a year, even 6 months, we show this is where your money's going. This is what it's paying for. And then the amount that is spent per member per month is so much lower than where they probably were coming from the year before.
Right.
And it's just because we're taking out probably thousands of middlemen. And that's it. And there's other things we do, but from a very basic perspective, if you don't have to pay the salaries for a skyscraper full of people, and you can just pay your doctor, you can pay your surgeon, you can pay for the things that you need, imagine how much more efficient your dollars will go. And so that's really a simple concept that's applied through the entire plan to every member, every day, every activity. So it compounds over time and the results are really unmatched. I'm not aware of any other solution that can match the efficiency dollar-wise with what we're doing.
Well, there's a qualitative component too, because like the average person like myself, I don't always understand those insurance bills. And so if it's more direct.
You're not supposed to.
Yeah, you're not.
Right. I kind of figured.
It's hieroglyphics.
Right. It's like, so there's a trust. I mean, it's trust. When I say there's a qualitative component, it's like it builds trust. And so the whole system sounds well orchestrated and very smart. So just so I can understand, so the doctors that you work with, and I think you may have already touched on this, and maybe I just didn't fully comprehend it. So is it like a cohort of doctors that participate, or?
Let me jump on this one real quick because I want to say this. Because he come from the doctor world, I come from the insurance world, so that's where I first think, right? So you're going to hear this from employees because you were W-2 at one point, not anymore. You're an entrepreneur, but W-2 employees are trained to use their insurance card.
Yes.
And they're trained to say, is it in network or out of network? Would you agree with that?
Oh, yeah. That's why I asked that question.
Yes.
Yeah.
Why would you need a network if we own the plan? So people here would say, right, because in Kentucky, Baptist owns what? The state, and Norton owns what? Louisville,
Mhm.
right? So that's really the only two. Like I used to have Appalachian Regional Healthcare. There were 6,500 employees, but they got sold. Like that's what happens, just like insurance carriers. They aggregate. So as they aggregate, they're training people to say, use your insurance card. But your insurance card is just nickel and diming the insurance plan that the employer bought. Does that make sense?
Yeah.
So every time you go in, like I use the joke at Golden Corral, right? Like they're going to go get the filet, the lobster, which sounds disgusting at Golden Corral.
I was typical.
But right. But then they're going to get 400 chocolate strawberries and eat 12. Like they've already paid the $29.99 or whatever it is. So like, why not use it, right? Otherwise you lose it. So that's the methodology that everyone has been trained on. So our biggest pushback from say like a broker or a business owner is, well, he's not in network. And then he says, okay, let me take that theory. You know how many hospital bills are paid 100% in full? There's
I pay such a small percentage.
20% are paid in full.
Oh my
So
God.
that means 80% are either paid less or not paid at all. So no wonder they built the system the way they did, because they have so much money. I mean, I could go so many directions with this, but to bring it back in, we don't need a network, because I have doctors. So when you say, how many do you have? What do you have? We've got, dozens and dozens of doctors. You would get assigned a specific one. We try to regionally base that, because the regional flair of someone in Columbus, Ohio is different than Miami, Florida. So we make sure that we're regionally doing it, and our care navigation team understands the difference between a South Carolina person and a South Dakota person and a, Washington person, because they're all different.
Oh yeah.
But those networks are just happy to get paid. So if we're administrating a plan, it doesn't matter what network you're in, because Mike's team is going to say, 4 doctors have looked at this and 5 nurse practitioners, and this is what the patient needs. So considering 20% of your bills are actually paid in full, we will give you the Medicare price today. And this is normal. Plans do this all the time. They're doing it on the back end. We're just doing it at a much more efficient rate. So on average, I'd say most plans are 130%, 35% of Medicare if they're good at what they do, would you say?
Yeah.
So we're getting 100. What's our average right now? 100.
It's around 100.
Right at 100%. So that's 30% in savings right off the bat in the same network. So stop asking me the question of where's my insurance card and what are we in with the network?
Right.
Because that's not the right question to ask. You want to go to Dr. Smith? I can make that happen. Here's an example. This will blow your mind. Or Will, this will blow your mind, dude. I want to hear more from Will, by the way. But if you have a surgery, there is it depends. The numbers vary, but between 20 and 60% if you do it at a surgical center prepared for that surgery than doing it at a hospital. Yeah. So just our doctors calling Floyd Memorial, getting it transferred with the same doctor and the same surgeon for that, let's just say, in the name of Jesus will never happen to you, but let's say a knee injury, right? Which dudes can get because we're dudes. So a knee injury cost me $25,000 for an ACL surgery. You want it with Dr. Smith at Floyd Memorial. Would you mind if I moved it to Dr. Smith's surgical center? He's actually better there because it's built for surgery. It's not a hospital with all the BS that comes with a hospital. Make sense?
Yeah.
It is 80% less cost.
Wow.
We can show you the data, but they don't know to do that.
Now the patient doesn't go to the hospital.
Yeah.
Who wants to go to a hospital?
Exactly.
I don't want to go to the hospital.
Exactly. I didn't even think of that. That's a good sales pitch right there. I didn't even think about that side of it.
Oh my God, I don't ever want to go to the hospital.
But does that make sense, guys and gals? Like
avoid it at all costs.
we're negotiating it for you because
just
you're not capable of doing that because you don't know what to say, and the doctor doesn't know what to correct, but we do.
I didn't know that.
Yeah. And also
They don't want you to tell her.
Yeah.
And also, if you create those relationships with those types of surgery centers and you say, hey, we can pay you, we're, on behalf of this patient with a health plan, we can pay you a bundled price day of service. They'll say, yeah, let's do that. And we'll just say, what's the cost? We don't need to negotiate. They understand the economics of paying upfront, paying cash. Discounts are already built in. We don't even have to ask. They understand that. They know why we're asking. Why would anyone ask, what is your self-pay rate? We want to know what it costs to pay cash. Plan pays that on behalf of the patient, the day of service, and they're saving, a lot on that, even up to what Jordan said. A lot of times it's 30, 40, 50% just on that. And that extends across any kind of service that you can essentially plan for. Anything you can schedule pretty much has a self-pay or a cash pay rate. And that's really where we generate a lot of the savings day in and day out. And it's just like anything else. You pay cash straight up for anything,
Right.
you're going to get a better deal. Medicine's not any different. It's just, it's not the natural thing for people to do. The natural thing is to show your card, pay the overinflated rate. And that really goes to another point. And you're talking about networks, is the networks are like really losing their value nowadays. I think in several years they may not even exist because there's so much overlap with them. The discounts aren't really discounts anymore. Like, when's the last time someone said, I'm so glad I'm in this network, that bill was like so low, that was the best discount ever? Yeah, no one's really ever said that. So they're losing their value. They're not really what they were intended to be. They've kind of like fizzled out. And now really the way, just because of how expensive things have become, the way to kind of curb that cost, to contain those costs for employers, is going to be to find these solutions that are very vigilant towards cost. So that cash pay, that direct pay mechanism is really, if you can figure out how to do it, that's really the way to go about it and to drive savings in a world where you can go to different facilities in the same town and get prices that are 10x difference.
Right.
If that's the world we live in, which it is, you need somewhere where you can actually have a plan that pays a fair price to a high quality provider. And fortunately, they're plentiful enough that it can be done really almost anywhere. You just need a plan in place to be able to execute it. And that's really what we're doing.
Right. Yeah, this has been very eye-opening. Like, I have learned a lot. I really, really hope that you guys get like so evolved in this that maybe you could get the health insurance to pay for plastic surgery.
It's all about how you code it, right?
Well, you can. There are ways.
There are ways to code it.
I'm talking straight vanity. I'm talking vain. I'm talking this patient is just vain, and she has a podcast, and she does TV, and she looks at herself on camera. She sees things going on, and she needs to have.
He's reminded me.
I know. I'm uncomfortable. Like looking at the whole time.
So that's what I'm talking about. Just straight vanity. Maybe one of these days the health insurance companies hear it all. Get that figured out. Some aesthetics. So yeah. Is there anything else you guys want to touch on? We've covered a lot. This has been incredible. I learned so much. I will watch this again. Every single piece of information that you guys have communicated, the average ordinary person does not know. They don't. And it's sad, especially our blue collar workers. I grew up in a construction family, and they were filing workers' comp claims, all the time. They'd get hurt on the job sites and insurance wouldn't pay, and it was just really, really sad.
And they're the ones that deserve this the most. They've built everything that he and Jill has said.
They have.
So they should be receiving this more than anyone else.
AI can't do their job. And it's like, I saw that for so many years, and these men just worked themselves to death because they did not know anything else, and they got screwed so hard. And they're not, and nobody told them anything. They don't know.
Yeah.
And I've got more degrees than a thermometer. I didn't know a lot of what you all said today. I've just been like, I owe this, okay.
Yep.
And pay it, sure. You say $3,000, sure, here you go. What for? What? Yeah. So that's gone on for as long as I can remember. But yeah, this has been really, really informative. And I'll put all of your information with the episode so people can easily find you.
We appreciate that.
Yeah.
For sure.
Thanks for having us on.
Yeah.
Yeah, the pleasure is ours. I mean, we'll come back anytime. But
The Thought Snob Podcast with Paula Swope has been brought to you by Thought Snob Media in association with Special Purpose Studios. All production, mixing, and sound engineering by me, Will Swope. We hope you've enjoyed this podcast. Please take a few seconds to give us 5 stars and leave a review. See you on the next Thought Snob Podcast with Paula Swope.